Good morning, everybody. You're all very welcome. It's fantastic that you've all made the time to join with us this morning. So, why are we here? Well, I suppose at present, home support providers are playing a bit of a waiting game, although you've seen draft regulations and draft standards. There's been an understandable reluctance to make significant changes to policies and procedures until I suppose you've seen the requirements that are embedded until they're fully released. But however, there's a lot that can be done now to ensure that the burden is managed on an ongoing basis when we face into a significant regulatory framework approach. So we know, I suppose, from previous experience and from seeing HICWA's modus operandi, they very much lean into national policy and into best practice guidance, and that supports their model of their regulatory approach. So with that in mind, there's a lot, as I said, we can do now to ease that transition by incorporating that national policy and best practice requirements and guidance and bring it into our policies and procedures currently as we move forward. Okay, so if we look back before we look forward, we know that the pathway of legislation, it was laid out in the draft standards for us, that there's a requirement for our primary legislation, that drives, I suppose, the change in relation that is required for the Health Act. But that's going to be the legislation that demands the licensing of public and private home support providers. Then on top of that will be the secondary legislation or regulation, which would give more specific information in relation to home support providers and what is expected of them. And then that will be supported further by the national standards, which would be developed by HICWA. So where are we at present in relation to that layout? Well, the government have approved the publication of, back in December, they approved the Health Amendment Home Providers Bill to move through the process. And as it currently stands, we're at stage 3 of 11. So that bill, once it becomes an act, will provide for a scheme of registration and inspection of persons who provide home support services for older persons and those with disabilities in their private dwellings. So a little bit left to go in relation to that. We have seen draft regulations previously, but in relation to the secondary legislation or regulation, the bill, which will become the Act, has already detailed the extensive provisions for that subsequent regulation, which will be carried under the Service Quality and Operations. So this is what we can expect to see when that regulation is released down the line as that secondary model. So unsurprisingly, we've got care, welfare and well-being of service users, adherence to rights and needs, qualifications and training of staff, statement of purpose, specific policies being required in relation to safeguarding medication support, IPC, risk management and quality assurance, how we provide service user information is going to be addressed, written agreements, and also notification of incidents and management of complaints, management of records. So all regulation that we would have seen before in other health and social care services that will be required through the regulatory framework. We know that HICWA are continually moving on the pathway. They released their business plan for 2026 and they make reference to the home support model and their engagement, which is ongoing. So under the service focus, they said that they continue to engage with the Department of Health on approval and publication of national standards and developing a plan around implementation support tools. And again, they set the target date for that for the end of the year. It's not a drop dead date where we'll have the standards by that, but it reflects their continual engagement. Also, they detail under the governance and organisational effectiveness that they're working with the Department of Health to prepare again for the commencement of that regulation when the bill is enacted. And I suppose, again, they are also in that waiting game for how that progresses through the houses. Although we don't know what the standards say, we do know that the standards are going to be principle-based. The HICWA released this document in 2021 saying that the future of all the standards are going to be principle-based. And on the basis of that, we can see that one of the sections that I've just pulled out here is that there is a requirement for managers ensuring that the service is complying with relevant legislation, fair enough, and regulations, but also in relation to national policy, standards and guidelines to ensure that people are safe and that their needs are met, and that the service requires clear policies which are informed by that legislation and national policy to support the delivery of its outcomes to deliver effective services in relation to that. So irrespective of content, we know that that will be the approach that will be applied by HICWA. So looking back on the bill and the content that was detailed within that, I've just selected 6 sections from that just to take a look at some of the current national policy, best practice guidelines that are applicable in these sections that we can currently apply within our policies and procedures, which will bring us a long way down the compliance framework when it comes to be. So I started with risk management. I would say that generally for health and social care services that are embarking on this, on the regulatory pathway, risk management is one that can really be a little bit of a struggle. It's a very big chunk of change. There's a lot of elements to it, and HICWA take a lot of time to focus on the organization's approach to risk management. In relation to the policy that's out there, the HSE Enterprise Risk Management Policy was released in 2023. That is a significant document. It superseded the HSE Integrated Risk Management Policy in 2017. Some organizations still are utilizing that 2017 version because the enterprise one has been quite daunting, but it has been superseded, is no longer reflective of the best practice. And there are additional requirements in that enterprise edition as they relate to inherent, residual and target risk ratings and the changes that are required in relation to risk description format. Another model that can give us a lot of support when we're developing our risk management model is the ISO 31000 risk management guidelines. It's a very useful resource in how to lay out our risk management approach as we move forward. For our experience in relation to risk management and what works well, I see risk management very clearly as 4 distinct pillars. 2 of the pillars can fall under the HSE Enterprise Edition, that being corporate risk management and general service risk provision. And they are probably the ones that require the most amount of development within organizations that haven't been previously regulated, particularly corporate risk. So we have those 2 pillars. Then you have individual risk management, which is generally managed quite well, about identifying individual vulnerabilities, through your environmental risk management process. And then the 4th pillar is the health and safety risks. Now, generally, services are pretty good at that final one, that health and safety risk pillar. But as I said, the corporate risk can be one that requires a bit more development, consideration of economic conditions, changing regulations, changes in finances, in environment, in new projects that are coming on board, that these are elements that can have a direct impact on the quality and safety of care being provided. And it is really important that we are cognizant of those and incorporate them as part of our overall risk management approach. The enterprise edition itself, the pathway is familiar to you all, I'm sure, in relation to risk identification, analysis, evaluation, and treatment, although the inputs in relation to identification may vary where we are incorporating corporate risk and service provision risks. Obviously, there's an expectation that we're utilizing an overall risk rating score matrix, and then based on the risk rating, that we're reacting in appropriate manner, that there's a risk evaluation criteria there that we respond to in relation to our risk. Again, generally utilizing the HSE Enterprise Edition for our management of corporate and service provision risks. They have quite a detailed template that they provide, the green being the current position of risks and the red identifying the actions that are required to reduce the risk level. So those tools are available for the HSE Enterprise Edition, and there's a significant amount of training also available on the HSE website in that regard. Health and safety, as I said, we see that as a separate pillar, and sometimes, as I said, organizations can get it kind of crossed wires in that there is a separate set of legislation and regulation that relates to that, and a significant set of guidelines that are also applicable in relation to health and safety risk management. But it is a different approach than the Enterprise Edition. Just want to bring this one up. It's one of the Be Smart models for the development of your safety statements. They have a full suite of risk assessment tools that you can utilize, detail your controls, your required actions. It's quite a useful tool, and from that you can drive out your safety statement. So it's just one to consider. I know most of you will have pretty robust health and safety risk management processes in place as it currently stands. So when HIC would come in relation to risk management, what do they look for? They're looking for 4 clear pillars: a corporate risk provision, individual risk management, and health and safety. And there's a clarity, and not only on the processes, but in relation to the roles and responsibilities of those who manage the processes. And that incorporates teams also. Obviously, it's a different team that's going to be managing health safety risk possibly than those that will be managing corporate risk. So that needs to be thought out, planned, considered, and documented. They're expecting those that are involved in risk management to have appropriate experience and training. It cannot be just one person that's doing all of the work for risk management. It requires multidisciplinary involvement across the board, obviously, to get that full holistic approach and comprehensive knowledge and input in that regard. They're looking for active and ongoing engagement in actions, that we just don't identify an action that's required and leave it sit there. They want to see how that's managed on an ongoing basis. How do we manage our communications and learnings? And this is going to be particularly important for those of you working within a group, that to ensure that learnings are communicated from a group perspective and not just within a singular service. And most of all, they're expecting it to be dynamic and flexible. And that is really difficult when you have 4 separate pillars, and it can be quite laborious, but they're expecting that the risk management model is continually evolving and updating and always responding to incidents and complaints as they arrive in that regard. So a lot of detail there in relation to risk management, and your policies and procedures are really required to be very robust to have clarity in relation to those policies and procedures. Linking to that then in relation to incident management and what we need to consider within our policies and procedures at present time. Well, obviously we've had the Patient Safety Notifiable Incidents and Open Disclosure Act. The notifiable incident element of it. We're a little bit between two stools, as most of the reporting is required to a notified body. We don't have. Those of you within the authorization scheme will be completing that via the NIMS. But certainly the Open Disclosure Act and the HSE Open Disclosure Policy of 2025 is very applicable to you all currently. And there's a lot of detail and requirements in relation to that, and that needs to be incorporated into your incident management policy and indeed into your complaints policy also. The model for incident management is generally the go-to is that incident management framework from 2020. And we'll have a quick look at the step-by-steps that are required in relation to that. From a best practice guidance documents, HSE have released both a checklist for the open disclosure policy and also an audit tool to help you to ensure that your incident management framework and your open disclosure tool or your open disclosure processes are aligning with best practice. So the incident management framework from 2020 has a clear 6-step process. It's really important at the beginning of our policies and procedures that we have a clear consideration of how we're preventing the incidents from occurring. And I'll talk about proactive and reactive response throughout this presentation, but it's really important that we have real consideration on how we prevent incidents from arising by supporting a culture where safety is a priority. So that's a significant element of the procedure that needs to be carried. Then if an incident does occur, how do we identify it? What containment or immediate actions do we need? How do we manage our initial reporting, notification, escalation? And then the primary element is the categorization of these. And it's important that we have 2 very distinct processes depending on the categorization of our incidents, where we have a category 1 incident, where it is rated as major or extreme, that we have a systems analysis model in place, one that requires probably independent engagement in relation to it, and then how we manage our category 2 and category 3 incidents, generally those being managed in-house. Irrespective of the category, they need to all to be reviewed and analysed, and the level of that, I suppose, is dependent on the categorisation. And then from that, we need improvement, planning and monitoring. So within our policy and procedure, for instance, we need very real clarity in relation to how this is managed on a step-by-step basis. Incident management obviously is very closely linked with our open disclosure. It's important that our policies would look at the 10 principles for open disclosure and see how our processes or how our organization is ensuring that that's being incorporated. It has a clear 5-step process for the actual application of it. And they're looking for real roles and responsibilities to be identified for designated liaison persons, an open disclosure team in place. Have we clarity in relation to the required timelines for open disclosure? How do we manage apologies? What's our annual reporting requirements? So there's a lot of content there also that needs to be incorporated. If we look at incident management as a whole and the expectations, suppose if HIC were to arrive in the morning, they're looking for a culture of openness, transparency, and accountability, which is supported by senior management. They're looking for that open door approach where staff are confident to be able to report incident without any form of retribution. They're looking for roles and responsibilities in relation to incident management. That's not just from an individual perspective, but from a team's perspective. How is our governance model managing incidents, taking that information, utilizing it, and reacting appropriately? If incidents do occur, they expect us to use a person-centered response, which is, and that is utilized then to drive continual improvement measures. Obviously, that process and application of open disclosure is going to be central to it. How are we taking learnings? How are we communicating it throughout our groups so that we can possibly prevent incidents from arising again? And also those external reporting requirements are very important, be that to the HSA or be it to the HSE or the Gardaí, whatever the case may be. We need to have clarity in relation to external reporting requirements. So linked to that is complaints. I'm not going to spend too much time on this. I'm sure your complaint management models are pretty well embedded and you're utilizing the your service, your say model in relation to it. Again, your open disclosure policy needs to be incorporated here and make sure that we have all of those elements within our complaints policy. One of the guidance that's really important, particularly in relation to complaints, is the fundamentals of advocacy. That's a HICWA document. Advocacy is really important to HICWA. It's central to almost all of the quality and safety processes as it goes through. They're looking for not only independent advocacy to be made available to service users should they require it, but also that our staff are adequately trained to support to work as an advocate on behalf of the service user within the organization. So that's certainly one to review and to incorporate. From an overall perspective, what are they expecting to see? Real clear roles and responsibilities all the way up to the register provider, for the complaint officer, the review officer. Sometimes that review officer gets a little bit lost in the fog. They want really clear roles and responsibilities in those. Your service, your say, the 4-stage process, I'm sure you're very aware, but it's really important that the timelines that are set out in your service, your say, are strictly adhered to. They're looking for written report responses to complainants. They want clarity in relation to how you manage redress and apologies. They want a section to clarify how you manage unreasonable complaint behaviour. As I said, independent advocacy, really important. We need to have clarity in relation to that. Confidentiality and data protection, how we manage it, how do we monitor our complaints data, and again, external reporting, and that is implemented within the required timelines. So that's it in relation to complaints. Now, safeguarding, I'm going to focus solely here in relation to vulnerable adults and not in relation to children. There was a significant suite of documentation released from the HC in relation to child safeguarding, which is, as I said, significant and will require a lot of work to incorporate that in relation to your child safeguarding elements. But I'm just going to focus on the vulnerable adults section. Obviously, you have your vetting legislation. From a standards perspective, we have the national standards for adult safeguarding also. And then national policies. Well, the HSE Safeguarding Vulnerable Persons, that's a 2014 document, and we have the HSE Trust and Care, which is a 2025. Now, the HSE have released a national policy framework for the adult safeguarding in 2025, which lays out their plans for safeguarding over the next 3 to 5 years. So although it's not mandatory for implementation now, it is just detailing the plans for the future, but it is important that we're aware of it and the content, and certainly those national policies will be up for review in the very near future. For me, safeguarding is about proactive controls and reactive controls. And again, HICWA would expect a clarity of understanding in relation to that. We would generally have a safeguarding policy, and then we would have a policy that details how we respond to allegations of abuse so that there's no, that we have real clarity in relation to those proactive controls. So what are they? Well, there are corporate controls. What are senior management responsibilities in relation to safeguarding? What are the responsibilities for our designated safeguarding officer? How are they documented? What is the content? And what's the understanding of their application? Obviously, our recruitment, vetting, and staff training, that all feeds into our safeguarding, and that's central. I'm sure that's work that you have all ongoing at present. How do we manage service user communications about safeguarding? So ensuring that they're aware of safeguarding and how to ensure safeguarding, how to look for safeguarding protections. And then the general controls during service provision. How do we protect the rights, dignity, and privacy of service users? How do we support informed consent? How do we ensure involvement of care? All of those elements significantly form part of the proactive controls for safeguarding. Financial protections, how do we manage those in relation to our service users? And then the application of professional boundaries. How do we train our staff to ensure that those relationships that are developed are appropriate in every case? Then the reactive controls, this is where we would have two separate processes then in relation to responding and reporting allegations of abuse outside of the service, and then managing an allegations of abuse by a staff member. So again, these are both driven by the national policies I referenced, and there are a clear step-by-step process. There's a lot of content here. There's a lot of requirements, a lot of roles and responsibilities, and appropriate timelines. So it does take a significant amount of time to ensure that all of the requirements are addressed and incorporated into your policies and procedures, and appropriate training rolled out in that regard. From an expectations perspective, what do HICWA expect to see? A holistic, person-centered approach, those proactive and reactive responses, and that service users are supported to live their life to the full, provided with care and support, provided to meet their needs, that they're supported by staff who are well informed and are competent, and that they are kept free from harm and safe from all forms of abuse. Looking for proactive or reactive controls again, and then that all concerns are taken seriously, reviewed and investigated. They want to ensure that service users are provided with an independent advocate where required or requested, and that any elements of informed consent is in line with the HSE National Consent Policy and the Decision Support Services Agreements. Now, we could have a standalone day training in relation to consent and all of the requirements, but it is a significant element that would be incorporated, and that feeds in to the safeguarding processes. Now you're going to have a little break from me. I'm going to hand you over to my colleague Rebecca, and she's going to bring you through some of the key elements as they relate to infection prevention control. Thanks, Rebecca.
Hi everyone, thanks Oonagh. So just with regards to infection prevention and control, or IPC, so when it kind of comes to effectively demonstrating compliance, our IPC policies and procedures really need to be grounded in the relevant national standards and guidelines. So in terms of standards, the key one there would be the HICWA national standards for IPC, which is specific to community services. And then there's a number of relevant guidelines there in relation to IPC as well, and it's worth kind of noting that those suite of guidelines are continuously being changed and updated. So ongoing monitoring of these guidelines is quite important, just to keep your local policies and procedures up to date with the most current best practices. So kind of key ones there would be the Department of Health IPC National Clinical Guideline, general public health guidance that's released from the Health Protection Surveillance Centre. And then you've got the HSE's Community IPC Manual and IPC recommendations for the use of PPE. And then you've got your immunisation guidelines for healthcare workers, which come through from the National Immunisation Advisory Committee as well. So I'll be quite relevant there. And then just in terms, taking a closer look at the HICWA IPC national standards. So these standards do apply across quite a broad range of community services, including home support services, which are specifically included within the scope of those standards. So just important to be aware that they are specifically named within the scope of the standards. So in terms of IPC requirements, what the key requirements would be for home support services. So the first one there, governance processes. So see from the previous slide that leadership, governance, and management are one of the key themes that are covered in the national standards. So that would include having things like clear lines of accountability and responsibility for IPC within the service, having designated leadership and structured management teams that have oversight of IPC processes within the service, and that there is a formal IPC program in place within the service just to have oversight of that. Then implementation of standard precautions. So again, you have your hand hygiene, PPE, management of laundry, waste disposal, sharps management. And again, some of them may be a bit more applicable than others depending on how clinically focused the service is. But there is a requirement that the service would have in place and implement policies and procedures around standard precautions and ensuring that all staff have adequate training, at induction and on an ongoing basis on the requirements to implement those sort of standard precautions, regardless of known or suspected infection status when working with service users. And then, sort of similarly to the standard precautions, then we have transmission-based precautions. And again, that the service is implementing policies and procedures around transmission-based precautions. Staff are all adequately trained where appropriate to their role. And again, that may be dependent on how clinically focused the service is, but that staff are familiar with implementing contact precautions, droplet or airborne precautions where required, if there is confirmed infection status when working with service users. Vaccination requirements then, so essentially that the service is ensuring that there are occupational vaccination arrangements in place that are in line with the National Immunisation Advisory Committee guidelines on immunisation for healthcare workers. Then the management of infectious disease or outbreak management, so essentially ensuring that there are kind of clear procedures in place for notification to the Department of Public Health if required where there are outbreaks, that there's clear escalation pathways in place internally within the service, that there are clear documented operational plans and monitoring mechanisms in place for the provision of services in cases of an outbreak. Service user communications then. So essentially just ensuring service users are informed about any IPC measures that are in place in relation to their care, supporting service users to recognise signs and symptoms of infection, and the importance of reporting any illnesses in themselves to healthcare workers. And then on the back of that, ensuring in turn that healthcare workers are also familiar with the signs of symptoms of infection in service users, which kind of allows for monitoring and early detection, and ultimately aids in the prevention and control of spread of infection. IPC monitoring processes then, so essentially involves monitoring through structured IPC programs within the service that can include monitoring things like audit findings, surveillance data, risk assessment findings, incident trends, surveys, feedback from service users and their families, as well as setting and monitoring KPIs in relation to IPC within the service. And then finally, external reporting requirements, just ensuring that there are clear lines of responsibility for any external reporting requirements within the service. So again, example, if there is a confirmed outbreaks of infection, that there is a designated individual or team responsible for notifying medical officers within the Department of Public Health in relation to outbreak management. And that's all for IPC, so I'll hand you back over to Oonagh now.
Thank you very much, Rebecca. Excellent. Lots to do in IPC. Always another one with a lot of burden involved, but a very important one. Just to finish up from my side, the last one I wanted to cover was in relation to quality assurance. Now, we don't have a national policy that's going to tell us exactly how to manage this, but what we do know from the HICWA guidance, this for the assessment of designated centres for older people, that their expectation is that the governance systems ensure that service delivery is safe and effective through ongoing audit and monitoring of its performance, resulting in a thorough and effective quality assurance system in place. So this one has a little bit of flexibility in relation to how we approach it. But what we have seen that has been effective and is important to have, we certainly from the outset, we need clear commitment to continual quality improvement through the governance model. And again, from all of those elements that we've looked at today, they're looking for senior management to take key roles and responsibilities to ensure their implementation. It can't be one person down the bottom trying to move the requirements up through the service. They're looking for senior management to have a real understanding of it and are progressively moving towards continually improving the processes within the organization. So they're looking for senior individuals to have real roles and responsibilities in relation to quality assurance and continuous improvement, and that there are teams also there in place to drive those improvements throughout the organization. We need to have a quality and safety assurance program, irrespective of what type of health and social care service that we have. The central element of that is going to be the audit program, supported by KPIs or feedback mechanisms and a quality improvement project process. I'm just going to have a quick look at each of those. Audits by far, I would say, if we did a trending of all of the HICWA audits and the types of non-conformances and issues that are identified, HICWA are in the audit requirements or the audit process certainly would be up there with all of the top ones in relation to the number of issues that have been identified with audit processes within service providers. In many cases, audits can become a very much a tick box exercise. HICWA are very much pushing back against that. They expect the same level of thoroughness and robustness in the inspection process internally as they would apply externally as an external body. And we see time and time again findings in relation to that the audit reports were not reflective of the issues that HICWA had identified on the day. So they're looking for that level of thoroughness as part of our audit process. In relation to our definition, we're looking for a systematic evidence gathering process. Audits must be independent, which can be challenging. They have to be independent. They have to provide evidence that's evaluated objectively to determine how well the audit criteria are being met. So they're looking for real evidence in relation to whether a criteria has been achieved or not. And that takes a bit of doing, and it takes a certain amount of training in relation to the audit process. If we're looking for a model to assist us on how we do auditing, ISO 9011 is a really good one. It clearly details we need an internal audit schedule with independent auditors of that area. They don't have to be external, but they have to be independent of the area that they're auditing. So that schedule needs to be clearly outlined and detailed who's doing the audits and within what timelines. It gives us clear guidance on how we plan them. We have to complete documentation review before we go on site. We can't just rock up and start completing an audit. We need to have understanding of the sector that we're auditing. And perhaps we need to develop an audit tool before we go out to complete the audit. It gives us guidance in relation to application, how we do open and closing meetings, how we sample, and how we document our audit trail records in that regard. And then how do we complete our reporting and learning? How do we communicate findings? How are they managed? How are they monitored? How are they escalated? So all of those elements are clearly addressed. If we're looking for a policy or a process to support us in audit, that's quite a good one. KPIs, as you know, are used to identify where performance is good and meeting desired outcomes and where it needs improvements. Again, from this perspective, I just say that it's important that it includes both service and managerial related measurements. We want to incorporate, say, completion of our home care plan reviews, our completion of our internal audit schedule to date. It's an important one. They see that as the key monitoring process that you have in place. Whether you have specific IPC indicators and you're tracking those, how often are you looking at your risk register? Achievement of incidents and complaint timelines. So a lot of people fall into the trap of saying the number of complaints or number of incidents. Just because you have a low number of incidents or low number of complaints doesn't mean that your service is achieving what it needs to achieve. It just might be that there are barriers to actual reporting. Looking at our service user satisfaction levels. How are we retaining our staff? How are we achieving our training plans and those regards? So all of those are for consideration when we're setting our KPIs. Service user feedback mechanism is really important also. And I suppose our go-to would be the in-house surveys that we complete maybe with staff and certainly with service users. But there are other aspects that need to be considered. How do we manage our day-to-day in-person feedback? Are our staff open to non-verbal satisfaction cues, and do they have the gentle communication techniques to be able to collate that in-person feedback as they provide services? When we're doing our home support care plan reviews, do we work on feedback in that regard? Do we do structured home visits for feedback? Do we complete telephone-based feedback? I mean, I'm not saying all of those are required, but we need to ensure that we have a robust process so that communication can come in from our service users and staff and that we can react and respond appropriately in that regard. Quality improvement projects are important. There's a lot of information or that actions that come out from, say, management team meetings or internal audits that there may not be a particular home for. There may not be incidents. that they should be managed appropriately. And the quality improvement projects certainly achieve that. We allocate a risk rating, we manage them by a team, and we address, monitor, and trend them accordingly. So it's a good way of collating that information and ensuring that it's not lost and that it's utilized to drive continuous improvement in that regard. Now, with all of that said, and we've just looked at 6 very small elements of the Act that, as it's referenced, how can we help? Well, we have developed a suite of home support service policies and procedures that incorporate all of the current national policy and best practice guidelines as they currently apply today. They also incorporate the HC authorization scheme content requirements, and each of the elements of the content are linked to the source, so you can identify exactly where the content has arisen from. How do we access those? Well, that's via Clodagh, which is one of our digital solutions. And Louis now is going to give you a very quick demo in relation to how that operates. Louis.
Thank you very much, Oonagh. I'm just going to go over and share my screen. Can you see my screen?
Not yet. Now you're away. Yep.
Excellent. So as Oonagh mentioned, we have our Clodagh platform, which is a digital quality and safety management system where, with all of you touched on, Oonagh, with your quality insurance, you can run audits and KPIs and QIPs through it. But importantly, I'm just going to start on access to those information and those policies. So I'm logged here on scale down to the size of a mobile. I ask a simple question to Clodagh in plain language, and on my mobile, I can do voice to text. So as I'm about to go on my shift, what do I need to do? Here I'm asking it to tell me about lone working. And with only the information that is embedded in the system, which is called a closed loop system, Clodagh, the AI digital assistant, can help you provide that information rapidly to your carers in the community. Lone working refers to any situation or location where they work close without direct supervision. And as you can see at the end of each of those bullet points, we put our direct link to the policy on lone working policy and procedure. So for the ease of demo, I'm just going to go out further here just to show you a little bit wider. So it is a web-enabled system. It's available on any internet-connected device, mobile for community workers, desktop, laptops, iPads, and so on. So suitable for a wide array of services, including home support. As well as access to information, Clodagh shows me my workload. So those documents that you have in the system that are in date need to be distributed to your staff. So I can ask Clodagh, what are the policies that I need to acknowledge? So here you can see I have 3 outstanding documents, and one of them is around that infectious outbreak or use of PPE that Rebecca touched on. As I click on the document, you can see here I've got the full template. This would be your content there that I need to read and acknowledge. And up at the top, I need to acknowledge that document. In this instance, I have said that this policy is a critical care policy, and I have to have a demonstration of my competence of this, where Clodagh generated a multiple choice quiz. And in my role as a carer, I need to answer the questions related to this policy and procedure to demonstrate my understanding of it. And should I get it incorrect like there, I need to reread the document and retake the quiz. So this quiz is only applicable to specific documents that you set up or specific staff members who need to demonstrate their competence and understanding of that policy and procedure. If I go back out to Clodagh, we have some prompts below to direct your staff to certain elements. And again, as Oonagh outlined about reporting incidents, what is the process that I need to follow in reporting an incident aligned to your quality assurance, your regulations, and it's going to direct me through that specific workload here of to report an incident, you need to follow these different steps, including all the elements. This is coming from this document, which is my incident management framework within here, and it'll be your content, obviously, without in the other environment. As a staff member out in the community here, I can also ask Clodagh on my mobile, do I have any training outstanding due? So with my direction of what my training is, kicked me out of that environment for a second. Unfortunately, I'm working from home today. So if I just show you here, I can say, what's my outstanding training? And it's going to direct me through to that training of what's outstanding for me. So here I've got an IPC training that's coming up. I need to mark this as complete, where I would attach my certificate of completion. It could be a supervision, could be in person, could be mandatory training, and so on. So really easy to update your own personal records for your care staff in the community. If I'm looking for a specific document, all of the documents in the environment are in the library, where we've got a full management of those. So editing, issuing the documents to the individuals. We have a full repository of those historical ones here, so you'll be able to see what documents were made obsolete and for what reasons over time. And if I go back to my library, I can look at all of my documents. So this can be a list of my full documents that are in this environment. This is the list that Clodagh can answer questions from. She cannot go outside of this active documents that are in the system to answer any queries. It's called a closed loop system. If I'm looking for a specific policy, I can type in here and say incident, and it'll bring up anything related to my incidents, such as management of adverse events, incident framework, my identification and review and communication, and so on. We also have a full configurable, so laying out where they are, what's in my effective services. These are the 17 documents we have under those specific headers, including tying them to the HICWA and the HSE regulations. So you can audit your policies and procedures and ensure they are aligned to the specific regs and standards that need to be applied, tying again, as Oonagh outlined, into the quality assurance over those. For managers, and again, in this environment, I have all of my permissions turned on. I get to analyze exactly where my compliance is in terms of my documents. If I'm an owner of documents, I have some drafts and approvals. And you can see in this environment, we manage these documents, so we've got a very high compliance rate. But if I look at those overdue, I can see who the owners are. We've got Caroline, Regina, and John. And in a list format, I can push out a reminder and say, your document owners of these, they're overdue, you need to update them. In terms of that compliance, I can then demonstrate that all of my staff have accessed, opened, and acknowledged the documents, and those that actually have a quiz related to them, I can also demonstrate my compliance. I can do some benchmarking and see where my compliance against my different departments to ensure that everything is aligned. And if again, as I need to, I've got my list format, and I can send direct reminders to these 3 individuals that they have to come in and update these records. So we've got some really nice automations and reminders in there to ensure everybody is compliant with their workload of what they need to do. So again, frontline staff, Clodagh is in their pocket, accessible to all of your information at the point of care delivery in the community, plain language asking questions of them, or you can put prompts about directing them to certain information. And as a line manager, I get to see all of that compliance, ensure my documents are up to date, and we can demonstrate to the HSE and HICWA that we have them in date, accessible to everybody, and that we're all compliant with that content and support our staff in the community. Whistle stop tour of Clodagh. Be more than happy to speak to anybody in more detail, and we'll get some information over to you after the meeting.
Thank you very much, Louis. Who doesn't love a quiz? I know I do. That's what I'd spend my time at. So everybody, thank you so much for attending. I hope you found the content of value. As Louis said, any of us are available to speak to you at any stage. If you'd like to have a little chat about any of the information provided, we're more than happy to do so. And until next time, we'll say goodbye. And I hope the sunshine comes back eventually. All right. Thank you very much, everybody.
Thanks, everybody. Thanks,
Bye-bye.
Oonagh.
Thanks, everyone. Bye bye.